Hello, Connecticut, and welcome to the Paid Leave Podcast. The title basically says it all. I'm Nancy Barrow, and I will be delving into this new state program and how it can help you and your family. This podcast will give you information you should know about Connecticut paid leave and maybe just a little bit more. Connecticut paid leave brings peace of mind to your home, family, and workplace. Welcome to the Paid Leave Podcast. In 2024, infertility continues to be a really significant global concern. 17.5% of the adult population, that's roughly 1 in 6 people, experience infertility. Male infertility is responsible for about 20 to 30% of infertility cases, while 20 to 35% are due to female infertility, and 10 to 20% of the cases, no cause is really found. One of the barriers for some people is cost, with single IVF treatments costing up to $20,000. Center for Advanced Reproductive Services is now one of the largest in Connecticut and one of the most successful family building programs in the country, responsible for the births of over 18,000 babies. That is amazing. The center is an academic affiliate of UConn School of Medicine and just opened their newest location in Middlebury, where Dr. Maya Barsky practices. She is the lead physician at the Center for Advanced Reproductive Services and assistant professor in the Department of OBGYN at UConn School of Medicine. She's also an infertility specialist. Welcome to the Paid Leave Podcast, Dr. Barsky.
Thank you. I'm so happy to be here.
So happy to have you here. Also joining the podcast is Crystal and Everett. They're a couple in Connecticut who have used IVF to build their family and had their first child. And congrats, because I believe you're pregnant with your second, Crystal?
Yes.
That is
July.
so exciting. So exciting. And Everett has used Connecticut Paid Leave, and we'll talk to him about that a little later on. But thank you both for coming on to the Paid Leave Podcast, Crystal and Everett.
Thank you.
Thanks for having us.
Dr. Barsky, what is the definition of infertility? Let's just start at the beginning, I guess.
Yeah. So the definition of infertility, actually, I'm so glad that you asked this question. It recently was updated by ASRM, which is the American Society for Reproductive Medicine. And really, originally, what we say is infertility is when couples are trying to conceive, so having regular unprotected intercourse for 12 months when the female partner is under age 35, or for 6 months when the female partner is over the age of 35. It also includes anyone that has a medical diagnosis or problems that they've been diagnosed with, such as PCOS or endometriosis. So they don't have to be trying for 6 or 12 months if they have a diagnosis attached to their infertility. But now it further includes anyone that needs to use donor gametes or donor embryos, which means donor egg or donor sperm or donor embryos, in order to achieve a successful pregnancy, either as an individual or if they have a partner. So they need medical intervention to be able to have a child. And so that really is wonderful because it is including much more inclusive of our LGBTQ plus community.
Well, how do you guide a couple who comes to you who've tried to conceive naturally and they're unsuccessful, or they have an underlying health condition?
So that's a good question. We start with just a discussion of their medical history and understanding of what their goals are. I think really understanding, where do they want to be and what are they looking for in terms of their family building desires and potential. And then we do a full evaluation. And so really understanding what is going on in terms of their reproductive system, from ovaries, fallopian tubes, sperm, and if they have sperm, and understanding if there's any abnormalities that we can identify. So that's how we start.
How do you diagnose? Because some of the things like endometriosis, you need surgery to even get a diagnosis. Some of them are really hard to diagnose.
Absolutely. There are medical aspects of infertility that are challenging to diagnose. And as you say, endometriosis can be very challenging. A lot of women have endometriosis, don't know that they have it, or a lot of physicians don't think about endometriosis as part of the differential of what's going on, and they're not working them up for endometriosis. In fact, about 50% of infertility patients have endometriosis. So anyone coming in with infertility, that should be just on the back of our minds as part of something we should be looking for, especially if they have painful menses. In terms of an infertility diagnosis, as we talked about the definition of infertility, it's not challenging to make an infertility diagnosis. If a couple has been trying to conceive for 6 months or 12 months, they have infertility. Mm-hmm. It really is not being able to conceive for after trying for a certain amount of time. The PCOS is a diagnosis that we can make based on the criteria for PCOS. Fibroids is based on ultrasound findings. So it depends on what we're looking for, but really to say infertility as a diagnosis for an individual or a couple is something that can be made pretty easily, and then, treatment can be offered based on that. The male evaluation mostly consists of a semen analysis, mm-hmm. and that really gives us a lot of information about the sperm in terms of volume, concentration of sperm, their motility, the way that they look, their morphology, and gives us an idea if there's a male infertility aspect. But that really is the extent of the initial evaluation for the males.
And there's lots of different treatments. What are some of the ones that are very common or not so common?
Yeah. So, first we will target if we find something that is contributing to the infertility. So let's say they have a thyroid issue that's causing them to have irregular periods. Well, we're going to give them thyroid medication, or some other hormone like prolactin. If that's elevated, we'd be giving them a medication to suppress that. So it really is tailored to what the findings are. But some of the things that we offer is strictly a fertility treatment, and especially for unexplained infertility, which means after this full workup that we do, we find no specific cause as to why the patient or the couple are not being able to conceive together. Then we offer medication to help with ovulation. That's an oral medication, usually either Clomid or letrozole. And we can offer IUI, intrauterine insemination, where we're able to concentrate the most motile sperm and place it into the uterus, which means that the sperm has less of a distance to travel to the fallopian tube where it's going to meet the egg for fertilization. So that's one aspect. The other would be IVF. And IVF really stands for in vitro fertilization, which means that we are fertilizing eggs outside of the body. So the treatment for IVF is trying to stimulate ovaries to mature eggs so we can retrieve them, take them out of the body, and then get sperm, again, a lot easier, sperm from the males, make embryos in the laboratory, and then do an embryo transfer. Mm-hmm. And so, for the LGBTQ plus community, sometimes there's different ways that this could be accomplished, whether we need donor sperm. Sometimes we do shared conception for our same-sex female couples where one of the females has the egg component of the pregnancy and the other carries the pregnancy. And then we also sometimes need donor egg or a gestational carrier, which is, someone that carries the pregnancy and has the uterus for those females that don't have a uterus, can't use their uterus, or for same-sex male couples that don't have access to a uterus either.
Crystal and Everett, let's talk about your journey to grow your own family. Do either of you have any underlying health issues that you knew about that might make pregnancy an issue?
I was diagnosed just after birth with a genetic disorder called cystic fibrosis. Mm-hmm. It's extremely common for men with cystic fibrosis to deal with infertility. So I knew since it was a thing that I was thinking about in terms of family planning that I was probably going to have some sort of involvement with a center, or in this case, the center. Yes.
When you wanted to get pregnant, how did you accomplish that, and who did you go to, and how did you get help with that?
So first I talked to my cystic fibrosis doctors. They're sort of my resource for everything. Mm-hmm. And they directed me to Dr. Honig, who is, I think, at Yale. This was quite a few years ago. This was sort of very early on. Crystal and I were fairly recently married, and we wanted to, get an idea of what we would be looking at, the timeline. So I met with Dr. Honig to find out what the process would be like with him. And he said, go see Dr. DiLuigi at the center. And so we went and met with her. And then there was kind of a long window. We thought we were ready. And then, like many things, the pandemic arrived and very much delayed
everything.
Our plans. Yeah.
Yeah.
Well, not only on our end, but the center understandably had cut back some services at that time as well. So for us trying to navigate with Everett's health concerns, and then also on the center's end, it kind of delayed everything. So we ended up starting the process. It was the middle to late 2020. We did egg retrieval and then embryo transfer in January of 2021. And then our baby girl was born September 2021.
So did you just have to have one treatment?
Yeah. So
Wow.
with my all of my background screening that the center performed, doing blood work and genetic carrier testing, all of that, we didn't really find any issues on my end, so everything went remarkably smoothly. I did one round of IVF, had to take a little break afterwards. After the egg retrieval, I took a 1-month break and then transferred a frozen embryo. And it really did go so smoothly. We're so fortunate.
Now, tell me a little bit about the IVF process. Is it painful? Is it a long process? Is there any recovery that you need?
You know, it's funny. In the moment, it's all consuming. You know, it's daily blood work. It's almost daily ultrasounds. It takes over your whole life, but really is, in retrospect, looking back on it, it was, the blink of an eye, and we have our daughter now, and it's so crazy to think of that time in our life. It feels, when looking back on it, feels difficult, but it also feels like it was so doable and really went by quickly.
Yeah.
For us, at least.
I bet. And Everett, for you, who, you knew you had cystic fibrosis from a young age, and it might be a problem for you to have children, this must have been like the most amazing thing to you, that science has done such incredible work that you could start your family.
Yeah. Miracles of modern medicine, really. Having our daughter is not the only one. I also have had a lung transplant, and being born in the 80s with cystic fibrosis, the likelihood that I made it through young, even becoming a toddler, the probability was not great.
No.
It's over and over again. Medical advances in technology have enabled all the best things in my life. So, it's been so fortunate for me, and to have found someone like Crystal who's been willing to, really bear the more difficult part of the whole IVF process. I had one procedure where I went in and they extracted what was needed, and then they just kind of hand it back to you and make you take it over to the center yourself, which was sort of a surreal experience. Crystal had to do everything that was difficult about this process. So to find someone like her that I could experience this with has been.
And now you're doing it again. It was so easy the first time that you decided. It was
easy. We got lucky. We had we had a number of very healthy embryos, and so the second time was much easier than the first.
It was just the embryo transfer that we had to do, which was.
I didn't have to do anything, which seems ridiculously unfair.
Right, Everett?
Yeah. But it was much easier, the embryo transfer, and we got incredibly lucky again in that it worked the first time that we tried it.
Boy, you guys are very lucky. I have a friend who's been, they have a child from IVF too, and they've been trying, and it's really emotionally draining, I think, too, for couples. I think it's really difficult when you know that you can't do this on your own and you need help.
Yes.
Yeah.
I think emotionally that must be really difficult, and stressful. How did your relationship, I mean, did it make you stronger, do you think? Because I think that must be hard on a relationship.
I think it really did bring us together in a way that we hadn't experienced yet. And I'm so glad you brought this up because I had never had therapy before this whole process started. And Everett was the one who suggested it and had me consider it. And I am so thankful that I had started it. I started it about, right when we were starting the IVF process. And I feel like it was so valuable. And I would encourage anybody who's struggling with the emotional aspects of infertility to definitely reach out to talk to someone because it's been invaluable.
Do you find that, doctor, that a lot of your patients ask you, can you recommend someone? Or because it's so stressful.
I wish that was the case. I mean, I would implore that anyone undergoing fertility treatments would seek mental health professionals because it is stressful. The diagnosis itself is stressful. The treatment is stressful. Sometimes negative outcomes happen and those are stressful. The reality is that a lot of patients don't pursue therapy, while at the same time, 40 to 60% have anxiety and depression. Wow. So we have many patients with a diagnosis of anxiety and depression, on top of the fact that you don't need anxiety and depression prior to going to infertility to really benefit from a therapist while you go through it. The psychological impact of not being able to conceive is a profound loss for some and could be really a significant life crisis for many. And for some, really, there's data to indicate that infertility could be as devastating as a cancer diagnosis. It really is very impactful. And individuals feel isolated and stigmatized and find it difficult to be around children. They feel shame, they feel guilt. There's a lot of cycles to the cyclicity of IVF. Hope and then loss can happen. And so it really is, I think, essential for providers to talk about it with patients, but also for patients to accept that it's not a failure if you see a therapist. It can only be helpful.
Yeah.
So, Crystal, I'm so glad that you mentioned that. It is really important.
Yeah. And just in the realm of Connecticut paid leave, we also cover mental health treatment. If you needed to take time away from work, we would give income replacement for that. Let's turn my attention to you, Everett. Can you tell me your experience with Connecticut paid leave? I mean, I know it was cystic fibrosis related. So
in 2022, 22. Unfortunately, I was exposed and I got COVID in early July. And I wrote it out pretty well, all things considered. I didn't need to be even really hospitalized. But ironically, I was put on a treatment for COVID that interfered with my transplant medication, and the side effects of the interference were actually worse than the problems I had with COVID itself. And one of the things that ended up happening was I had this very strange, massive swelling in my legs, and it became bad enough that I was having trouble walking. And I ended up in the hospital for that. And around that time, I was, I had been working from home for a long time, and ultimately decided with my employer that the best move would be to try and take some time and utilize the paid family leave program. And I did. I sort of expected to kind of walk into a lot of sort of red tape and deal with a lot of incomprehensible forms. And I found it much easier than I expected. Honestly, it was a pretty straightforward process. And I overall felt it was I guess easier than what you might expect going into this type of program like this, an application for this type of program. It was pretty easy. The chronic condition of it, I just want you to know that every year you can take up to those 12 weeks, whether you have to go see your doctor, obviously, and you have to travel to see your doctor. I just want you to know that's available to you, and that's
what we kind of want to spread the news.
Yeah.
If you do have a chronic condition like CF or MS or any of those things.
2022 was very challenging health-wise. I did the triple-demic before it was cool. I had the RSV, I had everything. So I was very lucky to have the paid family leave. But fortunately, since then, very smooth sailing. I've been very lucky.
Excellent.
For 23 and thus far for 24. So fingers crossed.
Yeah. And we do have 3 types of leave. Like you can take the whole block of 12 weeks or whatever you need. And then we have intermittent if you do need to just go and see a doctor for appointments, and also reduce schedule. So if you needed to take like a half day, so there's a lot of flexibility. So I just want you to know, have that in your back pocket. Are there support groups for people going through infertility issues?
There are definitely support groups available. Resolve is a wonderful society and has a great website, which you can search by state to find support groups in your state. And currently in CT, at the Resolve website, there are 2, one led by a nurse and another by a social worker. There's also Hope After Loss. We didn't really talk about infertility, and then the fertility aspect of recurrent pregnancy loss is also another major aspect of what we do as reproductive endocrinologists. And so that support group holds groups for women and men who've experienced pregnancy or infant loss. So there are support groups available. I still think infertility is stigmatized, and many patients find it hard to talk about it with others, talk about it with friends or family, and let alone strangers. I think that support groups are important to have, but I don't know if the utilization is as high as we want it to be.
What is the best part of your job, Dr. Barsky?
All of it. I personally I fell in love with embryo transfers. That's how I knew that I was going to become a reproductive endocrinologist and fertility specialist. The transfer is just, I think Crystal knows, the transfer is just incredible. You get to see on ultrasound the placement of a catheter with an embryo in it, and then you can see the culture media being placed that kind of signifies where the embryo is at that moment in time, and the amount of hope that everyone in the room feels at that moment for this little embryo that we hope will turn into a positive pregnancy test, and then hope for a live birth from there. It's just beautiful. It's amazing that patients that have genetic disorders, that don't have sperm, that don't have eggs, that don't have a uterus, that just struggle with infertility, are able to potentially have biological children because of fertility treatments that we can offer. Is just incredible. It's an amazing job. I wouldn't do anything else.
And Crystal, when she talks about that, were you awake for that whole procedure? So you saw the placement of everything?
Yeah. So before you get to that point for the egg retrieval, they put you out for that.
Yeah.
You don't remember anything. But the embryo transfer, you get to see, they turn the screen towards you to watch the catheter go in, and it's really magical. It was cool. Did
you take time off for your first child? Were you able to take any time off?
A little. But I'm an accountant. I do taxes, and she was born right in the middle of the second filing season of the year.
How inconvenient for that baby to be
That's
born.
What I said. It's in like the last 3 weeks of the extension in the end of September, October. But I took a little time after that, like in November, and she's delightful.
Well, just so you know, you can take bonding leave, which is Connecticut paid leave, up to 12 weeks.
Yes.
A father can do that if you want to take.
That is the plan.
That
is the plan now.
Fantastic. I mean, it also helps with postpartum depression. So, hopefully you won't have any, Crystal. But, that's one of the benefits of the father being able to take some bonding time with the baby. It really helps the mom.
Absolutely.
Do you find that, Dr. Barsky, that when both parents can be at home with the kids, it's better for everybody?
Oh, yeah, it is. It helps in so many aspects. I mean, just the bonding between the mother and the child, and the father and the child, and then the ability to have a time to shower and maybe take care of yourself and perhaps have a meal or whatever it is that the mom would not have the opportunity to do. It's really important for the mental health aspect too, and for the bonding. This is an incredible opportunity for parents to be able to take. I think it's wonderful that Connecticut has this to offer. Going through fertility treatments, it takes a toll on patients. It's a lot of time. It's very time consuming. So the Connecticut paid leave could be very helpful for patients with an infertility diagnosis. I've seen patients that struggle to understand how they're going to do it. And prior to Connecticut, I was saying, this is a priority. We're going to make this happen. But at what cost to their job and to their finances? And so to be able to have a little bit of less stress based on the fact that they can request paid leave really can help patients. So I think part of the awareness in Connecticut is to say, hey, let's be aware of the fact that we can apply for this and see if it can help some of the patients going through infertility.
Crystal and Everett, your story is so amazing, and I'm so pleased you shared it on the Paid Leave podcast. Continued good health to you, Everett, and again, congratulations.
Thank you so much.
Thank you so much.
And Dr. Barsky, thank you so much for doing what you do. You look at this couple. I mean, it's just so amazing that this was available to them and they have expanded their family. It's so beautiful.
It really is incredible. I don't take it for granted ever. And I'm just thankful for the patients that come to see us and very happy to say congratulations to you both. I think that it's beautiful.
That must be the best part of your job.
The best. Absolutely.
Dr. Maya Barsky, thank you so much for taking time out of your busy day to lend your expertise to the Paid Leave podcast.
Thank you.
Thank you all for joining me. For information about the Center for Reproductive Services, where Dr. Barsky works, or to schedule an appointment, you can visit UConnFertility.com, and the phone number is 844-HOPE-IVF. The center has 6 offices throughout the state, including the newest one in Middlebury, where Dr. Barsky is. For more information or to apply for benefits, go to ctpaidleave.org. This has been another edition of the Paid Leave Podcast. Please like and subscribe so you'll be notified about new podcasts that become available. Connecticut Paid Leave is a public act with a personal purpose. I'm Nancy Barrow, and thanks for listening.